It's a quiet truth. The education system depends heavily on a highly specific, easily exhausted resource, the school mom. It's the parent who fights for their child's spot in a specialized program, the mother who attends every parent night, recital, and conference, advocating for her kid when the room is otherwise empty. Districts actually build their expectations around this baseline of relentless parental involvement to keep students moving forward. But that reliance creates a massive structural vulnerability. When a family hits a crisis and the mother is suddenly left to navigate it entirely without institutional backup, the engine stalls. You see this break down at the kitchen table. The moment a child hits a sudden mental health hurdle, like severe anxiety or a behavioral crisis, the gap appears. Parents are immediately forced into a labyrinth of high out-of-pocket costs and complex insurance networks, trying to decipher coverage rules late at night. Even if they find an in-network provider, they hit endless wait lists. And while they wait weeks or months for an appointment, the student's attendance drops and their well-being visibly deteriorates. Shifting the entire logistical burden of securing pediatric mental health care onto already exhausted parents fails the student and the district. To fix this, Georgia needs an integrated solution. MentalSpace School operates directly inside the K-12 ecosystem. Instead of parents leaving work to drive kids to distant clinics, MentalSpace uses dedicated school-specific therapist teams to provide same-day teletherapy. These embedded teams handle immediate crisis intervention as well as proactive long-term suicide and violence prevention protocols. To ensure families actually trust the care being provided, the network connects them with licensed, diverse, and culturally competent therapists. The support extends outward, offering family counseling sessions and wellness programs designed specifically to keep school staff resilient. By anchoring comprehensive care right where the students already are, the logistical friction that usually exhausts parents is eliminated. For school administrators, building this kind of system usually hits a wall of financial and bureaucratic constraints. MentalSpace clears the financial hurdle immediately. Medicaid patients pay exactly $0 for care. For private coverage, the network is built to be universal, accepting Blue Cross Blue Shield, Cigna, Aetna, United Healthcare, Humana, Peach State, CareSource, and AmeriGroup. Administrators also face looming policy deadlines, specifically the mandatory Georgia HB 268 compliance requirement hitting in July 2026. MentalSpace provides turnkey support to meet those exact HB 268 mandates, taking the implementation burden entirely off the district. And every student record is protected by an infrastructure that is fully HIPAA and FERPA compliant. Resolving the payment and privacy roadblocks turns comprehensive mental health support from a daunting administrative liability into a deployable asset. So, what mathematically happens when a mother's advocacy is finally backed by frictionless institutional support? This chart shows the impact on student attendance. When logistical barriers are removed, we see attendance improve by 89%. MentalSpace provides the institutional backbone that turns years of parental effort into realized results, honoring the mother's work with professional, systemic support. Because the strength parents pour into their children today is exactly what builds a healthy tomorrow. To close the advocacy gap and bring this support to your district, visit mentalspaceschool.com or email